Mr. Smith. I understand you are still in pain, but the aspirin you take at home is a low dose used to prevent a heart attack due to your history of heart failure, and it's actually not for pain relief. Aspirin is not safe to take before or after surgery due to an increased risk of bleeding, which you are already at a high risk for because of your anemia and because you are on heparin, which is an anticoagulant. Since your pain is now at an 8 out of 10, a stronger pain medication may relieve some of the pain in your leg. If you would like, I can administer some Vicodin 325 milligrams, which is a narcotic composed of a combination of. Sam, it is really important for you to continue to take your Lasix medication as it prevents your body from absorbing fluid, which is important due to your history of chronic heart failure, coronary artery disease, and hypertension. If you stop taking your Lasix, your blood pressure will rise, which could lead to a heart attack or a stroke. I understand you are frustrated you cannot sleep throughout the night due to the urgency. Would you like me to adjust the medication for an earlier time? Depending on when you wake up in the morning, we could administer your Lasix at 6 o'clock in the morning and 6 o'clock at night. Hi Sam, it is now 8 o'clock and it's time for me to administer your Lasix for the day. So your Lasix is used to reduce fluid retention and decrease your blood pressure. Some side effects you might see are some frequent urination and an electrolyte imbalance, so it's going to be really important for you to eat all of your meals because you may experience low potassium or other electrolytes, and you'll be given nutrients to supplement those levels. So I've already done the first 2 checks when pulling your medication and when preparing it. So I'm going to do the 3rd check now. So I have the MAR right here. So it says Lasix for Sam Smith, PO at 8 o'clock. It's 8 o'clock now. And it's 40 milligrams per tab, 40 milligrams per tab. Okay, here you go. Do you need any water or anything? Did it go down okay? Alright, sounds good. So after administering Sam Smith's morning medications, I noticed that he had a CT scan scheduled for the afternoon, but because Sam Smith has type 2 diabetes, he's on metformin, and the combination of the metformin and the IV contrast could lead to renal failure. So I would call the patient's provider using SBAR format and inform him of the situation. I'm calling about Sam Smith, age 82. I'm concerned about Mr. Smith having a CT scan scheduled for this afternoon. I have just assessed the patient and his temperature is 98.6, pulse is 64, blood pressure is 132/92, and respirations are 14. His blood sugar after eating his breakfast was 135, which is within a normal range. The patient has a past medical history of chronic heart failure, coronary artery disease, and hypertension, and also type 2 diabetes. Mr. Smith was given his morning medications at 8 o'clock, including metformin for his type 2 diabetes, which may react with the contrast IV dye, leading to lactic acidosis and renal failure. I recommend rescheduling the CT scan and discontinuing metformin for 48 hours so the medication is excreted before the scan. Since the patient is on metformin for type 2 diabetes, I recommend adding regular insulin to his medication to supplement for the discontinued metformin. How often would you like his glucose levels monitored? Mr. Smith, heparin is an anticoagulant that prevents the formation of blood clots. You know when you cut yourself and your blood becomes sticky right away to stop the blood from flowing? That is a blood clot, which is good to stop cuts, but bad if they get into your bloodstream. You are receiving heparin to decrease the chance of your blood clotting from your surgery, and you may be at an additional risk due to your heart failure, as your blood may be sitting in one place for longer. If a clot forms, it could lead to an MI, stroke, or DVT. You may experience extra bruising, but if you have any tarry-colored stool or excessive bleeding, you need to let your doctor know right away. The daily recommended dose of Tylenol is 4,000 milligrams, so taking 5,000 milligrams a day exceeds this recommended dose and can lead to stomach ulcers. Since the pain is resulting from your arthritis, which is the inflammation of the joints, I think we should try giving you ibuprofen instead. Ibuprofen is an NSAID, which means it decreases inflammation, which will decrease your arthritic pain and make it easier to hold your utensils. I am so sorry, Mr. Smith. I cannot give you any more Tylenol as I administered you 500 milligrams 2 hours ago and it is only safe to have every 4 hours. I cannot give you a Vicodin either as it contains Tylenol in it, which could lead to an overdose. I can give you a dosage of ibuprofen and NSAID to decrease your pain. We can also try non-pharmacological interventions to treat your pain, such as hot and cold therapy.